Hi, everybody. It's Dr. Christine Anderson here, and I am a Los Angeles chiropractor who's been practicing for about 30 years, for those of you who don't know me. And I'm super excited about talking about the topic tonight, which is fear, which is kind of weird that he's super excited about this. But it is so important because sometimes we let our emotions kind of get the best of us. And they can create these negative loops in our body that then drive us to do things that maybe we normally wouldn't do if we really thought about it. Or maybe subconsciously it stops us from living our optimum life. So, with everything that's going on in the world right now, I thought this would be a great topic to talk about. So, I'm going to talk about what is fear and anxiety. What is the emotion that, how is that created, and maybe some of the effects that can occur in our body. So let's start off with what happens in the brain when we feel fear. So it is basically fear is as old as life is on Earth, right? So we've got this fundamental, deeply wired reaction within us. And the reason we have it is it's there to protect our well-being if we're threatened. So it can be as simple as like the cringe of an antenna in a snail if they are threatened. So it can be very simple, or as complex as existential anxiety in a human if it's chronic fear. So it is induced by that perceived danger or threat, and that causes a physiological response in the body that drives our behavior, such as running away, hiding, freezing, doing what we need to do to survive this traumatic event, or perceived traumatic event, I should say. And that perceived danger can be real or imagined, and can be due to the threat of harm of our bodies, our emotional self, or our psychological self. So this threat stimulus will trigger a fear response in a part of our brain called the amygdala. This is part of our limbic system that controls our emotions, and it activates the areas needed for our bodies to create some motion, as well as the response of the sympathetic nervous system, which is the part that is our fight or flight system activating, that automatically responds, right? We don't have to think about our heart rate getting up and our muscles mobilizing. It just happens. Now, the amygdala also helps to store memories of events and emotions. It kind of ties them together. And the purpose is so that we can recognize similar events in the future, and that can be positive so that you don't have to go through a whole process, right? You're like, okay, I've seen that before. I know what to do. I know how to respond. So it's useful in that regard. But if you are then priming the brain to become overly fearful and chronically anxious, that's where problems can occur and prevent us from living our lives optimally. So, a major factor in how we experience fear has to do with the context. So, when our thinking brain, which is our cortex, it's going to give feedback to our emotional self and say, okay, are we in a safe space? Is this dangerous? Like, what's the situation here? Like, I've had this trigger, what's happening? And if we're already in a high arousal state, so if we're already in a fearful state, we're going to tend to get into that fearful state even more. If you're in a more relaxed state and the danger isn't too immediate, you have time to think about it. And, this kind of goes into the whole thing of sort of thrill rides and things like that, right? So there's an element of fear But our brain goes, yeah, well, this is a controlled fear. And I'll talk a little bit about that in a second. Now, the hippocampus is another limbic structure deep in the brain, and it's connected to the amygdala and also our prefrontal cortex. So, our prefrontal cortex is a front part. This is more talking about higher executive functioning, right? That top down control of what's happening in your body rather than reflexive and just whatever happens, right? And this is going to help your brain interpret the perceived threat. And I keep saying perceived threat because our brains can play tricks on us. It's incredible what can happen when we are in this sort of primitive limbic structure rather than critical and cortical thinking about taking in all the information. If you trigger a fear response, it's like you cannot hear and you cannot see anything. People trying to give you information and helping to understand what's going on. That's it. Once you get in that fear response, sometimes it's very hard to get out of it. And I see a lot of that right now. Okay. So, for instance, let's just use this as a for instance. When I go to Universal Studios Halloween Horror Nights, no matter how scary things might be, right? You've got people jumping out at you and chainsaws going off and weird, scary characters. Number one, I know they can't touch me. So even if they come at me, I know they're going to stop. And I know that they're actors, right? It's a contrived, scary situation. And you don't want to overthink it too much because that takes away from the enjoyment. But your prefrontal cortex, your brain is going, it's all going to be okay. Just enjoy sort of the fun scariness, right? But let's say I'm walking down a dark street and somebody jumps out at me that I don't know, my brain is going to kick into gear and go, yeah, we have to get out of here. We got to run. We got to scream. We got to, fight, whatever. Fight or flight will take over. And my brain will go, yeah, we're in agreement with that. This is totally a scary situation. So when the sympathetic system is activated, your body is automatically going into this physiologic response without you thinking about it. Your brain is hyper alert, your pupils are dilating, your air passages open up, your breathing is accelerating, your heart rate is up, your blood pressure is up, and you've got the blood flowing and the blood sugars going to your muscles to make them work. So all of this is occurring in a split second. And it's going to be helpful and useful in a short period of time just to help you get out of whatever situation you're in. And then you're supposed to recover. And I go into this a bit more, the stress response, talking about the optimal stress management. So I'll put a link to that. But basically, if you are continually in a state of fear or anxiety, this situation is going to continue to go on in your body. You're never going to have that rest and recover time. And that's going to be an issue that I'll talk about in a few minutes. The other aspect I want to talk about is this perceived threat aspect. And here's the thing. It's one thing to know you're in a scary situation or a fearful situation to get out of, but it's another not to have all the information and you're just basing that fear on what information you have at the moment. So, for instance, imagine you're in an apartment and you hear a dog viciously barking outside your door, right? Now, you're going to think, well, I'm not going to go outside that door. There's a vicious dog out there. They could attack me. It's dangerous. And you could be right. But you can't see through that door. There's no peephole. You can't see what's going on. So you're going to assume that there's a real dog out there and a real danger unless you have more information. So you may stay inside your apartment for days if you think that it's too unsafe to go outside your door, right? You don't know. But imagine if it was just a recording of a dog barking. So you wouldn't have that information unless you actually had somebody, unless you opened the door and peeked outside, if you were brave enough to overcome your fear to say, you know what, that's weird. That dog's barking for days. Let me check this out. Or that's a long time for a dog barking. What the heck is going out there? So that's an extreme example, but the same thing can go on no matter what is going on. If you're perceiving something to be fearful, but you don't have all that information, you're just kind of sticking with that information. Now, the same thing can even happen if a sign says a dog is dangerous. So there's a fence there, there's a sign, dog is dangerous, and you've got a dog there and he's just walking by. He's not even barking at you. But if you perceive that situation to be dangerous, you will start to have this fear response going on in your body, even if there's no other indicators. Now, of course, we can learn fear through personal experience, like being attacked by an aggressive dog, or hearing or seeing somebody else be attacked by an aggressive dog and then develop a fear of dogs based on that. And that's certainly reasonable, especially if you have a personal experience. But again, it's taking one situation and broadening it to all dogs are going to attack me, right? So when we are able to recognize what is and isn't real, what's a threat, what isn't really a threat, that is going to be a situation where we feel like we're more in control. And when we have that, even that perception of control, even if we're not in control, but we think we're in control, then that's going to be vital as to how we experience an event and how we respond to fear. So if we don't have enough information to make a distinction between that real or perceived threat, we're going to feel powerless. And that fear can then take up residence in our mind body because there is no separation of your mind from your body. And then chronic fear, worry, and anxiety can contribute to significant distress, dysfunction, and dis-ease. So I term it DIS/ease. So dis-ease, not at ease in your body. And that is going to limit your ability for success and joy of your life. And I don't know about you, but that's not a good place to be. You want to have all the experiences in your life, you want to learn from them, and you want to then be able to integrate and live your life to your fullest. Not be afraid to have experiences because something might happen. Right? All right. So chronic fear impacts our physical health, our memory, our brain processing and reactivity, and our mental health overall. So physical health wise, it weakens our immune system. It can cause cardiovascular damage, gastrointestinal problems like ulcers and irritable bowel syndrome because your intestines shut down, your digestive system shuts down when that sympathetic response is going. And it can even do things like decrease fertility when you're chronically stressed. It can lead to accelerated aging and even premature death. So, not good. As far as memory, fear can impair the formation of long-term memories and cause damage to certain parts of our brain, such as the hippocampus. Remember that? This can make it even more difficult to regulate fear, and it can leave a person anxious most of the time. And to someone in chronic fear, the world looks very scary. And their memories are going to confirm that. And everything that they're experiencing is going to confirm that. It's almost like, like attracts like. If you're thinking negative things happen. Well, in this case, it does. And then it confirms like, yep, world's a scary place. And this is something called amygdala hijacking. We do not want to be there. We don't want to hijack our amygdala. So, for the brain processing and reactivity, what fear can do is interrupt the processes in our brain that allow us to regulate emotions, read nonverbal cues, and other information presented to us, and reflect before acting and acting ethically. So, in other words, we're looking at it. If you're in fear, you can't look at the whole information. You can't read what people are saying, and their face expressions and their body expressions are saying. You can't hear anything they're telling you. It's just kind of like, nope, I've made up my mind. The fear has gotten to my amygdala. It's hijacked it. I don't want to hear it. So instead of rationally processing new information, your brain is just going to reflexively react. It's like that frontal cortex just can't work. It just can't make those executive decisions because that primitive brain, based on your emotions, has made its mind up. So it's going to make thinking and decision making impossible. It's going to leave you susceptible to intense emotions and impulsive reactions. And you may not even know why you're doing this and just acting out and making these sort of irrational decisions or conclusions based on fear. So once the brain gets ramped up that way, it can be very, very difficult to appropriately react. And then the other consequence of long-term fear could include fatigue, depression, PSTD, so many things, right? So we want to try and do what we can to release fear as soon as possible. So fear is an emotion, and like I said, it can help us survive. So we're not necessarily thinking of it as a negative emotion. It can have positive effects. It just is an emotion. We just want our fear to come and then go away. We don't want it to take residence up in our brain and our bodies. So what can you do? So number one, you want to try to reset your sympathetic system as quick as possible. If you're in a stressful situation triggering fear and anxiety, you want to try to calm yourself down as soon as possible, as soon as you can. If you're actually in danger, of course, you want to get to safety. So I'm not talking about that. I'm talking more about that emotional trigger of fear where your amygdala is hijacked and you're like in the moment. So if you can do things like take a moment and breathe deeply, breathe into your nose for 4, exhale for 8, and just keep doing that. When I'm doing this, I actually like to use essential oils called a memory release blend, which is coined by Dr. Benjamin Purkis. So I put a drop or two of this blend in my hand and I'll rub it together and I'll breathe it in. And it's a blend of lavender, frankincense, and stress away. So I'm going to be covering how to use essential oils in the Aroma Freedom technique, also using this memory blend right after the show on my Young Living with Dr. Chris YouTube page. So I'll put the link in the script in the description if you want to check it out. I can talk, I swear. Anyway, that deep breathing is going to help you kind of release the adrenaline, calm your brain, calm your body, and get your brain back to a calm place, to a more parasympathetic place, resting, rejuvenating. Sometimes for me, I like movement. So taking a walk while I'm breathing, listening to music and dancing around. So if you can recognize what is going on with you, that's kind of the first step, that you feel that fear, that you feel stress, that you feel threatened, but you've already figured out it's a perceived threat. There's not actually physically something there that is going to do you harm in the moment. It's just something that's going on in your brain and your body. And I say just, but it's huge. So you can kind of look around and try to have as much control as possible, the things that are occurring. Like looking around and going, okay, I'm here at my table, I'm sitting in my chair, there's, I'm safe here, and having all these positive thoughts and um, trying to counteract that fear, the things that are going to bring you safety and bring you down. If there's someone around that you can talk to or you can call that's aware of your fearful situation is certainly helpful. And reframing your perception by gathering more information. Because remember, the more information you have, the more you're empowered to make that rational cortical decision. Uh, it's not easy, but the more you do it and the more you practice it, then the easier it's going to get. Now, if it's really deep-seated fear or anxiety, you may need some help with releasing that fear, not only from your brain, but also your body. There's that connection. So sometimes with talk therapy, it's like, okay, my conscious brain gets it. I'm afraid. It's a perceived threat. It's not real. But in the meantime, I'm still freaking out. Well, that's because sometimes emotions get stuck in our body. And the emotion of fear can often get stuck in the kidneys, and this is based on Chinese medicine. So I've been working with something called neuroemotional technique for a long time. And this is a type of technique that utilizes the neuromechanisms of muscle testing, if you're familiar with that, which is basically asking the body. It's like a magic 8 ball or a lie detector, basically yes and no questions. It's based on the Pavlovian response, acupuncture meridians, and Chinese relationships between meridian points, repetitive compulsions, and the memory and physiological response. And what it does is it helps escort stuck emotions in the body and give it a conduit to release. So if you want to learn more about NET or neuro emotional technique, I really suggest to subscribe to this channel. So you're going to be notified when I post a new video or go live. And I will definitely be doing very soon a YouTube class or a presentation on neuro emotional techniques. So you can actually see what it is very soon. I can't give you an exact date, but hopefully before next week or soon after that. There are other modalities that can be used successfully to help access this mind-body-spirit connection. Things like meditation, bio and neurofeedback, brain tap, EMDR, NLP, which is neuro-linguistic programming, and then the AROMA freedom technique, which I will be talking about in like 5 minutes. So I hope this helps everybody. I want everybody to live an optimal life. I don't want you living it in fear. There's no reason to live your life and be afraid of living, because life is an experience. There's that illusion of safety that people can say to you about keeping safe, but it's an illusion because life is risky, right? We can do what we can do to take care of ourselves, and that's certainly important. You can't just be reckless, but if you're doing everything you can in your power, then you just have to know that you are, you're going to be okay for whatever is in store for you. All right. We can't control everything. And that shouldn't stop you from living the best life that you absolutely can, which is fully mind, body, spirit, right? All right. I'm going to sign off. If you like what I have to say, please give me a like or a thumbs up. Subscribe to my channel so that you know when I'm posting new content. And please share this with your friends, because we want your friends and family to have optimal health and an optimal life. Thanks so much, and I'll see you next week. I will have a special guest, so stay tuned for that. Bye.